The onset of winter has seen residents of Delhi grappling with the menace of air pollution yet again. The city has been reeling under hazardous air quality levels since the beginning of November. Apart from the surge in post-harvest paddy straw burning across the neighbouring states of Punjab and Haryana, emissions from vehicles, industries, power plants and burning of waste contribute to hazardous air quality levels in the Delhi NCR region. Unfavorable meteorological conditions like lack of rainfall, gradual drop in temperatures and calm winds that trap pollution have worsened pollution levels. Deteriorating levels of air quality have affected the health of a large section of people in Delhi. Hospitals in Delhi are witnessing a sharp rise in patients seeking treatment for pollution-related health issues. The health conditions of people already suffering from respiratory issues like bronchitis and asthma have aggravated. Hospitals are also noting an increased influx of patients suffering from chronic obstructive pulmonary disease, asthma-like symptoms, chest congestion, and other issues. This winter, patients with no past history of respiratory illnesses are also heading towards health centers with severe symptoms and have been diagnosed with pneumonia and acute bronchitis. Doctors are attributing this trend to the rise in pollution. The concentration of PM2.5 fine particulate matter, which has the potential to penetrate deep into the respiratory system and trigger health problems, exceeded the government prescribed safe limit of 60 micrograms per cubic meter by 7 to 8 times in the capital. It is 30 to 40 times the healthy limit of 15 micrograms per cubic meter set by the World Health Organization. Doctors assert that prolonged exposure to high levels of air pollution is associated with adverse impacts on human health like decreased lung function, aggravated asthma, and increased risk of heart attacks and strokes. A shocking concern that many doctors have raised is that the toxins mothers breathe can reach prenatal children through the placenta, causing damage to multiple organs. There is substantial evidence that air pollution impacts mental health too. Past research has associated air pollution with higher levels of stress, psychological distress, and increased risk of dementia, Alzheimer's disease, and depression. Doctors say breathing in the polluted air of Delhi is equal to the harmful effects of smoking approximately 10 cigarettes a day. In a report, the Energy Policy Institute at the University of Chicago revealed that air pollution is shortening lives by almost 12 years in Delhi. On November 7, the Supreme Court called for immediate action against the stubble burning practice of farmers in Delhi's neighbouring states, observing that it's one of the substantial contributors causing severe air pollution in the national capital during the winter season. The court also observed that stubble burning may not be the sole cause of air pollution, but it is still a major factor causing the deterioration of air quality. The bench remarked that Delhi can't be made to go through this year after year. The court also directed the Delhi government to ensure that municipal solid waste is not burned in the city. Following directions from the Supreme Court, the dysfunctional smog tower at Connaught Place in Delhi was restarted on November 8. It is claimed that the towers can purify the air in a 1 kilometer radius around the structure at a rate of around 1000 cubic meters per second. On November 5, the Commission for Air Quality Management invoked measures under Stage 4 of the Graded Response Action Plan. Graded Response Action Plan refers to a set of steps implemented to prevent deterioration of air quality in the Delhi NCR region. The plan was approved by the Supreme Court in 2016 and notified in 2017. Graded Response Action Plan categorizes action into 4 stages. Stage 1 poor, Stage 2 very poor, Stage 3 severe, and Stage 4 severe plus. The final Stage 4 includes banning all types of construction and demolition work. State governments are authorized to decide on online classes for school students and work from home arrangements for government as well as private offices during such situations. A complete halt on construction and demolition work except for essential government projects, mining and stone crushing is also enforced through the plan. On November 8, Environment Minister of the National Capital Territory of Delhi, Gopal Rai, held a meeting with a team from IIT Kanpur to discuss the possibility of artificial rainfall through cloud seeding. The minister also said that if there is 40% cloud coverage, then artificial rains could be made possible. He also said that the experts anticipate that such conditions could develop around November 2021. Long-term solutions to mitigate the early affair of dropping air quality levels and ensuring harmless breath are all that are needed.